one.
Hey everybody, we're going to talk about speech and language pathology. It is such a vital part of healthcare, especially for patients, children who have speech issues, swallowing issues, language issues. Also for adults who've had strokes and other traumatic brain injuries as well. So what a speech pathologist does is they study and treat speech and language problems. Um, it was introduced as the field of speech pathology. Um, uh, it was introduced many years ago, and for this particular person who did this video, they learned about it through other people. And most people who are not familiar with speech pathology do learn about it from someone else, or school may introduce it to their children, or maybe even their physician or pediatrician or a nurse practitioner may say, hey, developmentally your child um, is not progressing the way they should. And so let's see if speech will help. Speech therapy will help. Speech therapy doesn't, like I said, doesn't just help speech issues. It also helps with swallowing and taking the way people take medications, how they have to manage foods, whether they have to thicken it up, and what consistency it has to be. So it's not just someone with a speech impairment. There's a lot that goes into being a speech therapist. A licensed speech therapist makes a plan of care, and a speech pathologist, would be a speech therapy assistant, then they can also work in the school system or work with others about carrying through that program. Now, initially, speech therapists in the 1800s, they were considered quacks. They were considered someone trying to sell snake oil, basically, because it was just thought that if someone had a speech issue or a swallowing issue, or they had a stroke, then they weren't really going to survive. But over time, physicians learned. It became more prominent in Europe first, and then moved over as it moved over to the U.S. We started to recognize how important helping students that stutter, helping people that stutter, helping people that have language issues, a lisp, or they can't say certain letters, how working with them make them have more confidence, and that they're able to retrain their brain. Also, after a stroke, being able to determine what consistency of food someone can safely swallow. Do they need their liquids thickened? Do they need their food ground into a soft consistency so that when they swallow it, they don't choke on it? You have something called the epiglottis in your throat that will close off when you're swallowing, so things don't go down into your trachea and into the lungs, so that you don't aspirate. And sometimes after people have a stroke or other traumatic brain injury from car crashes or being hit in the head for some reason, a brain tumor, things like that, those things don't work appropriately. So we can help that patient along by having a consistency of food that the epiglottis would recognize and know to close off so it doesn't go into the lung. So like I said, speech therapists do really cool things. I've seen speech therapists not just work with speech, but I've seen them work with people with lung disorders to help improve their diaphragm, help improve vocal cord, people who have some paralysis of the vocal cords. There's all kinds of things, wonderful things I've seen speech therapists do. And like a physical therapist, a speech therapist gets to see and hear their progress. It's a very rewarding career. Most speech therapists truly love it. Now, this is going to it's going to talk to you about some specific graduate programs, but prior to going into a graduate program, you can major in speech pathology or linguistics. Those are the two most common undergraduate degrees or bachelor's degrees that people get, because speech therapy is a master's degree. So most people do do have to go and get a speech pathology bachelor's degree or a bachelor's degree in linguistics. And it has a lot to do with science, math, just like any other healthcare career, but it specifically, the other part of it specifically deals with the brain and the vocal cords and the anatomy of swallowing and speaking and all those kind of things. Um, so most undergraduate degrees, and this is going to give you 2 or 3 examples. I know that the University of Texas, Texas Tech, I think UNT, TWU, like physical therapy, have a speech therapy program. A&M has one, not A&M Commerce, but A&M College Station has one. I think UT Arlington or UT Dallas, one of them have a program. But with any program you're going into, like with physical therapy, that first year of college, you need to start looking to see where that graduate program, where is it at that you want to go to? What are they requiring? What prerequisites? What kind of degree do they want? What is the minimum GPA? And then you've got to do better than that. What's the minimum GRE? You need to do better than that, a little bit better than that to make yourself competitive. Spend time shadowing other speech therapists in different areas, in pediatrics and geriatrics. Um, spend time at the school with the speech pathologist. So those are things that you can do to also give yourself extra opportunity to when you apply to a graduate program. With the University of West Georgia, they have an excellent, one of the top programs in the country. And the ones you're going to see today are ones with some of the top programs in the country. Um, it's a master's degree with a major in speech speech and language pathology. They also, that's what the master's program is. To get into their master's program, you have to have a minimum of a B average or a 3.0 GPA and a 147 verbal and quantitative 147 overall degree. I'm going to tell you guys a GRE is similar to an SAT. So if you haven't taken an SAT to see what it looks like as you get closer to your junior, senior year, take it just so you know what it looks like. You may not do well on it. You may do fantastic on it. But when you're going to go into a graduate program, almost all of them require a GRE as part of a minimum GRE, a graduate score, a GRE score to get into their program. So at least, not only do you need to take an SAT just so you kind of see the familiarity to it, but also there are study guides for the GRE for each part. Make sure that the GRE that you're taking is equivalent to what the school is wanting. You're going to have 3 letters of recommendation from university professors and other speech therapists. Immunization. So anytime you go into healthcare, your immunization record has to be up to date. You're going to have your meningitis vaccine, your tetanus shot's going to have to be up to date, and any other vaccine, Hep A, Hep B. Most of you guys don't have to worry about that because it's a requirement for school. Like me, I was a little bit older. I was about 25 when I went into nursing school or started nursing school. And so there were some immunization requirements that had changed from back when I was 13. And I had to get a few more immunizations. So you're seeing graduate school is very expensive. For out-of-state tuition for 12 credit hours, so 12 credit hours is about 2 semesters in graduate school. 6 hours is a full load. You can take up to 9, but most people take 6 at a time because lots of people have to work during graduate school. It's $13,000. So basically, this program, by the time you buy books and tuition, pay books and fees and your tuition on top of that, is going to cost you somewhere between around $35,000 to get that graduate degree. There are some, but not a lot of scholarships, and there's no Pell Grant money. There's no grant money available for graduate programs, really. You have to get loans or you have to pay cash. So know that about graduate school. This is the University of South Carolina. Same thing, master's in speech and language pathology. You have to have taken minimum undergraduate classes of human biological science, which would be like anatomy, physiology, social and behavioral science. So they'll want you to have a sociology class, some advanced psychology, those kind of things, physics and chemistry and statistics. Those are part of that undergraduate degree plan. 4 speech related courses, um, at least prior to the summer before entering graduate school in the fall. You want 1,000 verbal and quantitative. So their GRE score, um, aim for 1,000 in verbal and quantitative on your GRE. It should be 100, not 1,000. So they want it a little higher, and you have to have a higher GPA. To be competitive, you have to have a 3.5 GPA to get in. 3 letters of recommendation. If you've done some shadowing or some work, that's going to help you too with those letters of recommendation from other speech pathologists, speech therapists. And their out of state tuition is going to cost you closer to $40,000 to get that graduate degree. So you have, once again, these are some of the best schools, but we have wonderful schools of speech pathology, speech and language pathology here in Texas. Growth potential. Some of the things, like a physical therapist, some people choose to get a PhD. If you get a PhD, you can own your own private clinic. You can specialize in children, adults, people with special needs like intellectually challenged or other kinds of things. You can get board certified like you can with physical therapy to help improve and to help prepare for you for that specialty, whether it's geriatrics, adults, children. You want to specialize in the educational system, those kind of things. It gives you a wonderful opportunity with those board certifications. General salary is about 35 to $38 an hour right now. Starting out, you start out between 60 and 80,000 a year. In Texas, that's a U.S. average, 73,000. Texas is closer to 75 to 78. We have a hard time finding speech therapists, especially in our area. In home health, we needed speech therapy a lot for people who've had strokes or other kind of traumatic brain injuries, and we had a really hard time finding speech therapists because they were employed by the school system, or they were employed by other physical therapy clinics, and they worked full time in a 8 to 5 setting. So know that speech therapy is very needed, especially in rural areas. There's a huge demand for speech therapists. So you're going to study and learn American Sign Language. That's one of the skills that's almost required, is that you have sign language skills. Work 400 plus hours in a private practice clinic geared towards whatever specialty. This one says towards kids with autism. So if you want to work with a specific set of kids, then that's what you want to do. You don't necessarily have to teach, but knowing how lesson plans work and working as part of your practicum, because you have a practicum where you have to spend time in certain locations, especially if you're planning to specialize. You have to spend a specific number of hours in that specialized area. And if you're going to work with kids in school, it is important to know how lesson plans work and how to help someone integrate that therapy into their lesson plan for those specialized students. If you're going to work with adults and geriatric patients, or elderly patients, people who've had traumatic brain injuries as adults, then you need to spend time in that kind of setting in a facility where you see how their activities of the day work. You see what their home environment's like. You see what kind of access to resources they have, so that you can definitely be prepared. So, also, there's an ONET score. An ONET score is kind of It's a sort of like a personality type test, and what it does is it kind of tells someone what that person, you or the person you're working with, how your brain kind of works. um, so do you have a conventional brain that is kind of concrete? Are you enterprising? Are you a very social person? Are you an artistic person? Do you like to investigate the way things, to figure out how things work and and how things happen? Or are you a concrete person? So that kind of helps you determine, because especially with patients, if you have an artistic patient, it may be really it may help you be able to function with that patient, because you know what, they can draw for you what they can't say. If they're an investigative person, then maybe you give them tasks so that they can work through a problem. If they're concrete, then you need images and to work with them over and over. If they're enterprising, give them challenges, give them ways to improve on where they have to work through it and figure it out. And then for your conventional patients, they're going to follow that normal plan of care, which is going to be a lot of your patients, to be able to function and learn and improve. American Sign Language, once again, I can't stress enough how important it is. If your school offers sign language and you're wanting to go into speech therapy, do that. Intern, that's what I talked about. This particular person interned in a clinic that specialized in autistic children. Find a speech therapist that specializes in what you want to do and intern with them. You're not going to get paid to intern with them, but you're going to learn. And if what you know, the more you know, the better off you are when you get into a speech therapy program. You have an idea of what you're getting yourself into. You know if this is what you really want to do. Shadow, intern, do what you can to get as much education before you spend your graduate degree money, which could be anywhere from $30,000 to $50,000. If you're going to get a PhD, it may be closer to $100,000. Before you spend all that money, know it's something you're going to love, and you're going to wake up every morning excited to do it. So once again, determine whether or not you're going to be that good candidate. And there's some places you can go look. The Labor Board of Statistics will tell you very, very quickly that speech therapy, physical therapy, and occupational therapy, the demand for them is going to double over the years. Be sure between now and 2025, the need for speech therapists, occupational therapists, and for physical therapists is going to double. So know that it is also a high demand field. All right, guys. So if you have any other questions about speech therapy, please let me know and I'll try to answer them the best I can. If I don't know the answer, I'll talk to one of the speech therapists I know and see if I can't get you some more information. Everybody have a wonderful day.